frequently asked questions on substance misuse. Is screening for substance misuse recommended? The U.S. Preventive Services Task Force recommends screening all patients for alcohol misuse, but has determined that there is currently insufficient evidence to recommend screening for other substance use disorders. Despite the lack of evidence that screening for substance use disorders improves outcomes, universal screening may be justified based on the high prevalence and morbidity of substance use and proven effectiveness of treatment. What tool is used for screening? Single question screen. How many times in the past year have you used an illegal drug or used a prescription medication for non-medical reasons? The Drug Abuse Screening Test 10 is a self-report instrument that accurately identifies substance abuse and dependence. Scoring: give 1 point for each yes answer, except question 3, which is 1 point for no. 0 points equals low risk, 1 to 3 points equals moderate risk, monitor and reassess patient, more than 3 points equals substance abuse or dependence. Sensitivity for substance use disorder equals 90% to 100%, specificity equals 77%. What if the screening result is positive? In patients with positive screening results, substance use should be stratified into hazardous use, substance abuse, or substance dependence. What is the management for hazardous use? Patients with hazardous substance use may benefit from brief counseling by a physician. Counseling using a motivational interviewing approach in the clinical setting has been shown to decrease the quantity and frequency of drug and alcohol use. During counseling, the physician elicits the patient's own reasons for change, rather than telling the patient why he or she should change. Confronting or pushing the patient to change is usually not successful and can decrease motivation for change. What is the management for substance abuse? Substance abuse is characterized by the development of consequences from substance use, and these consequences can serve as motivators for change. The primary care physician can be instrumental in increasing motivation, but should be prepared for patients' feelings of defensiveness, ambivalence, guilt, shame, and lack of concern about their substance use. Principles and techniques derived from motivational interviewing can be used to manage resistance and increase readiness to change. For patients with substance abuse, experts generally recommend advising abstinence. For patients who are not committed to abstinence, it is useful to provide a variety of options for change, and harm reduction is an appropriate goal. Harm reduction strategies reduce the negative health consequences of substance use. Common examples include providing clean needles to persons who continue to inject drugs, and not driving while intoxicated. Developing a plan for change is an opportunity for physician-patient collaboration and trust building. If a patient with substance abuse agrees to cut back or quit but is unable to do so, this may indicate a substance dependence disorder. What is the management for substance dependence? Substance dependence is a chronic relapsing and remitting illness, and patients require a longitudinal, chronic care approach that can include pharmacotherapy, referral to specialty treatment, mutual help meetings, and ongoing counseling and care coordination. Brief counseling can help an ambivalent patient with substance dependence to enter a treatment program, engage with mutual help meetings, or agree to a trial of pharmacotherapy. Because of the severity of substance dependence disorders and the importance of family support in the recovery process, physicians should engage family members in the treatment plan when appropriate and with the patient's consent. Treatment programs that involve families have improved rates of retention and abstinence. Is there a need to screen for comorbidities? Anxiety disorders, depression, bipolar disorder, post-traumatic stress disorder, and dependent and antisocial personality disorders are more common in patients with substance use disorders, particularly substance dependence disorders. The presence of a substance use disorder suggests the need for mental health screening. What is the treatment for benzodiazepine dependence? Physicians may attempt a slow taper, usually over months, of benzodiazepines in selected patients with dependence and in whom a reliable history can be obtained about the amount being taken. Patients should be motivated and adherent, and should not have a history of withdrawal seizures or other medical comorbidities. Other patients should generally be referred to a specialist, if possible. Risks of tapering benzodiazepines include increased anxiety and depression symptoms, seizures, and altered mental status. What is the pharmacological treatment for opioid dependence? Naltrexone is an antagonist of mu-opioid receptors and can block the effects of opioid agonists. This can prevent the impulsive use of opioids in patients receiving naltrexone, and can provide time for the patient to consider the consequences of relapse and to seek support. Naltrexone has been shown to be helpful in maintaining abstinence from opioids in motivated populations, such as healthcare professionals who cannot or do not wish to take continuous opioid agonist therapy. When is referral indicated? Referral for specialty addiction treatment is recommended for patients with substance dependence disorders. However, primary care physicians with appropriate experience, training, and support can provide some or all of these services.
Audio Jungle. Audio Jungle.